Dr. Zach Spiritos, is that how I pronounce it?
Yeah,
Thanks for coming in.
anytime.
We're going to just dive right into it so that, viewers, they get the information that they need. But today we're going to talk about mast cell activation syndrome, histamine intolerance. It's going to be the main topic. And then we're going to talk a bit more about other stuff. Your specialty, you're a GI doctor, and you specializes in mast cell activation. Is that correct?
Yeah, I'm a neurogastroenterologist. So I work in, so when you see a GI doc and you have complaints, nausea, pain, diarrhea, yeah, they're going to take a look in your intestines. And if they find something great, and they find ulcerative colitis or Crohn's or cancer, God forbid, and that's kind of a plumbing issue. They look in the tube and they find the issue there.
Yeah.
When it's more of an electricity problem, that's the world that I live in. So not only how the stomach and the intestines move, but how it's perceived. So if you have an issue and it doesn't get seen on a colonoscopy or an endoscopy, that test is not a set, it's looking for structural abnormalities, big lesions, ulcers, inflammation. But there's a lot of conditions that cause distress when those tests are negative, even with those tests being negative. And those the crux of which falls on how these intestines move or how it's perceived by our central nervous system, our brain. And that's kind of the world I live in, and kind of encompassed in that is the craziness of mast cell activation syndrome.
Got it. Is it like the vagus nerve? Yeah. I've heard
Yeah,
that vagus nerve stimulation helps digestion.
can certainly can.
Okay, great. And if we talked a little bit like a few days ago, and we did mention, which I think is important, that you also do some functional training. You have done some functional training as well, or you're looking also into the functional side, as opposed to just looking, obviously, because you're looking at the brain, but as opposed to just doing intestine, GI tract, trying to look at like the whole picture.
Yeah, I think I take a more of a holistic view on things.
Okay.
So take into consider sleep and your relationships and your levels of stress and your diet, because all those things have a tremendous impact on not only how our GI system moves, but how we perceive it and feel it as well.
Let's dive into it. What is mast cell activation syndrome? I hear it everywhere on social media, and I still have no idea what it is.
Me neither, man.
Okay, great. Next question.
Oh, let's that's been fun. Let's wrap this up. So man, when I was with an academic group before out of UNC, and I treated my world was these folks that had negative tests, but they have loads of symptoms. And we worked through some of these things and IBS and we run tests and we use medications, but there's always like 30 people, 40 people on my patient panel that I had no idea what was going on with them. And they had not only GI symptoms, but symptoms across every organ system, brain fog, fatigue, rashes, allergies, migraines. And so I look at their chart, and not only was I writing notes on their chart, but they'd also have seven other providers. And these people would be in their 20s and 30s. I was like, what's happening here? There must be some common denominator here that is that is causing all of this. I fully believe in Occam's razor, which is the easiest explanation is usually the right one. So as opposed to someone in their 20s or 30s having kind of unique individual symptoms and diagnoses in every organ group that are not connected and somehow statistically very unlikely. So it's like something has to be here. So that's when I started reading and I started learning about mast cell activation syndrome, and my world started to make a lot more sense. And so we don't get taught this in medical school. I think there may have been like a page on it at some point in time, but it's not a point of emphasis by any means. And so what mast cell activation syndrome is these mast cells, which are part of our innate immune system. So it's our first line of defense. They don't have any memory. They're not like antibodies that remember the infection that you had 30 years ago. They have no, they're pretty reactive and reactionary. So historically and evolutionarily, they were made to look for environmental stressors, fungi, bacteria, viruses, etc. And in mast cell activation syndrome, they are reacting to everything inappropriately. So as opposed to being called unintentionally, say, okay, there's a virus here, like do your thing, everything sets it off. Heat, barometric pressure, stress, foods, chemical scents, mold, pesticides, and everybody's different. Everybody has certain triggers. It's such a heterogeneous kind of heterogeneous presentation. But the mast cells live everywhere. They're most commonly on the areas of our body that interact with the environment. So our sinuses, our skin, our GI tract. Our GI tract is the way the inside of our body senses what's going on outside. Our respiratory tract or genital urinary tract, but they're also in like kind of less concentrated amounts in our brain, in our spinal cord, and our vasculature. So they cause symptoms everywhere. So brain fog, fatigue, sinus issues, allergies, rashes, migraines, palpitations, reflux disease, bloating, yada, yada. And it also sets people up for endometriosis as well. So why it's so tough to
Yeah.
why these people are so frustrated by the system is because the medical system is so siloed, right? So you have a GI system, GI issue, you go to a GI doctor. You have migraines, you go to a neurologist. But these symptoms cross all the subspecialties to where everybody's treating their own little thing, but no one's connecting the dots. So really complex, really heterogeneous. We don't know a lot about it. We're just kind of starting to understand more. And the system lets people down because it's not arranged in such a fashion to properly support people with mast cell activation syndrome and all the comorbidities that come with it.
Yeah, I mean, you kind of described what I went through where I had inflammation in my joints, so I went to a rheumatologist, but I also had redness on my hands and my body, so I also went to a dermatologist. And when everything comes out positive, like negative, then I went to an immune specialist, and then everything comes out regularly, or like normal, you go to an infectious disease specialist, and then you do all that stuff. So how does someone develop mast cell activation? Do we know? Is it just like you catch a nasty virus one day? Like I know everything started for me after getting, we think, dengue fever, which is a pretty gnarly virus. And 2, 3 months later, everything went downhill. That's just the assumption that we have. But how does somebody develop that? Or is it just from simple dysbiosis in the gut where you just eat trash for a lot of years and then you just have this imbalance in the gut that happens? Like, is there actual research on that or?
Yes and no. So everybody's path to it is different. There's some genetic predisposition for it. And so a huge genetic predisposition we see are people who are hypermobile and have something called Ehlers-Danlos, where their joints are very mobile. So we see that being a risk factor for developing mast cell activation syndrome. The philosophy is something called TILT, which is toxin-induced loss of tolerance. So these mast cells perform surveillance on the environment. And so the thought is that these mast cells are being triggered by the environment with which we live today. And it's triggered by the synthetics, the dyes, the chemicals, the pesticides, the mold. Like this world is changing. It's getting hotter. There's more Lyme disease. There's more mold. And all these things are triggering this mast cells. They're always being triggered to where they become very finicky and overreactive and constitutively active to where they're always spilling out their chemical meteors as opposed to being done so with intention and by design. And so, one of the critical pieces we hear all the time is that people with mast cell are uniquely, and not everybody has this, but are uniquely sensitive to smells. So they walk by like the Hollister store in the mall, which like just cologne smell, right?
Hmm.
And they almost have a freaking seizure because it's those mast cells in the brain that sense those chemicals, and they get kind of sent into a tailspin. But so to get a sense of like so there's the mast cells, the thought is that they start kind of inducing little hits, like this world induces little hits on the mast cells, and then something big happens, whether it's a vaccine or a virus like dengue or COVID, pregnancy, hormones, a big surgery, a stressful event, living in a moldy home, and then everything changes, where all of a sudden you're intolerant of things that you used to be tolerant of.
Hmm.
Not everybody fits that narrative. Some people, it's kind of a slow burn where it just kind of happens slowly over time. And the thought is that something induces a big mutation in the mast cell to where it's now turned on. And that's how you get there. But everybody's story is different. And some people have this classic story or this kind of classic presentation of hives and flushing and itching and food intolerances. But some people just have GI MCAS where they have a lot of diarrhea and bloating, and it's just in their GI tract. So everybody's presentation is a bit different.
And it seems like everybody just then gets it or develops it individually. Like it's not a clear path, right? Can somebody who's had no trauma through virus or any of that can develop it?
We see that a lot in Ehlers-Danlos, which is
Okay.
a condition where people are a lot more flexible, and that's not doing doing a horrible disservice to
Yeah.
hypermobility because it's a full body condition, and I think it's actually an autoimmune process. Um, but the one of the theories there is that mast cells also live in connective tissue, and if that connective tissue is being overly bent, then it's being triggered by that. Like that's not kind of they become aberrant because of all this kind of um, excessive bendiness. And that's what triggers the mast cell. So the mast cells, again, are reacting to the environment. So something is always triggering it. How someone gets to full-blown mast cell activation syndrome is incredibly unique. But it usually, I mean, your story is pretty classic where something big happens and all of a sudden,
Yeah.
boom, their life is not the same. And nothing in medicine behaves that way. It just doesn't. So
Yeah.
when we talk to someone in clinic and someone comes in with like a headache or chest pain, we have an idea of like what it is, but there's also plan B, C, D, and E. It's called a differential diagnosis. But the story that you gave, where you were doing okay and may have had some background noise, like maybe some symptoms growing up, and then boom, something happened, nothing behaves that way in medicine. And that's what makes mast cell unique, so unique. So we do have objective markers of disease that we can look for that are inherently imperfect for a variety of reasons. But in my book, when I talk to someone, the narrative is the most important piece.
There is something that I told all my doctors, which I was never able to get an answer for, is that when I go to the Caribbean, somewhere warm, whether it's been the Mexico and whether like around Mexico, like Cancun or Holbox or the French Caribbean, 80% of my symptoms are gone. And then when I come back here, they come back. I eat the same, but it's just, and so I remember being crazy.
Whoa. Are you sure you eat the same though?
I actually eat worse over there. I have bread.
Well, how is that bread made though, right?
Yeah.
Like
Yeah. It's made.
I've had a couple people move to Europe because their math is so much better in Europe. Because I am by no means an expert in how kind of food is made here in the United States, but
Yeah.
there's certainly less regulations here than there are elsewhere. And so was the food there, although it's bread, was it made in such a way that there's less, I don't know, like all the things.
Fermented.
Yeah, like, but so the food here is made, there's something about the food here that is different elsewhere, whether
Mhm.
it's pesticides or chemicals, or I don't know the nuance to it, but there is something here. I mean, here in the United States, people's mast cell tends to be worse. I
Yeah.
mean, it's a generalized statement, but I have had people move elsewhere because they feel so much better living in Europe.
So when I go to France, I still have my symptoms. When I go somewhere warm and humid, they tend to disappear like 80%. And I remember going nuts because I was like, how does this make sense? But you just talked about just the environment being different could trigger symptoms more.
And most people's mast cell is worse when it's hot out.
Oh, wow. I have the French Mast Cell Activation Syndrome. There's this difference.
Yeah, I mean, so everybody's triggers are different. So that's one of the main discussions we have is like what triggers it and how can we kind of how can we patch that up? And it's impossible sometimes. Some people it's stress, right? But stress
Yeah.
happens. That's life.
Yeah.
So you have to balance what we can do from a lifestyle perspective to stabilize the ship. Um, to kind of I think of mast cell as like you have this kind of this bucket, right? And when the bucket starts to overflow, that's when symptoms happen. So you have to understand what fills up your mast cell bucket. Is it stress? Is it talking to your in-laws? Is it the Glade plugin that you put in? Is it what you eat? And so it is kind of we use medication certainly, but there's also a diet piece of it and understanding kind of the
Right.
triggers that really aggravate your mast cells so we can kind of turn down the volume so we can make your mast cells a little bit happier.
So mast cell will get activated by multiple different things, right? Basically. So it could environment, food, lifestyle, stress. And then it's up to the patient to figure out with their practitioner what is the one that like how to reduce all that load, basically.
Yeah, so I will always say this is typically what bothers people with mast cell, like heat, right? But that doesn't pertain to you at all.
Heat feels amazing to me, and cold hurts my joint.
You got this crazy French mast cell that I
Yeah, I
cannot.
know, yeah.
Maybe French mast cell is a unique phenotype. But yeah, man, so I have this very long checklist. Like I took weeks writing this list up, and I force it on everybody, whether they want it or not, to ask them to interrogate their home, to look at the shower filter, the water filter in the fridge, the way they clean their house, their deodorant, their makeup, their toothpaste, to make it as mast cell friendly as possible, chemical free, toxin free. But it's impossible, right? Like it's impossible to do everything. And truth be told, the best way to go about this is to go become like a sheep farmer in New Zealand. But I'm sure they have pesticides there as well. I don't
Yeah.
actually don't know anything about New Zealand. I just made that up. But yeah, it's you really just want to, yeah, so it's a combination of understanding what generally speaking makes mast cells worse and then what makes your mast cell worse. And so I ask everybody to kind of perform this exercise in their home environment to make it as mast cell friendly as possible. Fortunately, cats don't make mast cell worse.
They do? They don't? Okay, good.
And if it makes you happy, then probably, emotional well-being plays a big people's stress and,
That's great.
Apparently their purring has like a healing frequency too to the body. So um what is the difference? Because that's another term that I hear a lot around social media. What's the difference between mast cell activation syndrome and histamine intolerance? Or is it the same thing?
not the same. So mast cell activation syndrome, or when these mast cells are very twitchy and they're secreting their chemical mediators, and they have over 1,300 chemical mediators inside of them. Histamine happens to be one of them. So you can get these kind of histamine dumps, right? Mast cell can be, as we mentioned, can be aggravated by a lot of things: stress, chemicals, temperature changes, barometric changes, everything. Histamine tolerance is a little bit different. So where in the Venn diagram they overlap is these histamine dumps. But what brings on the histamine dumps are categorically different. So in histamine intolerance, it is due to either an inactive or poorly functioning enzyme called diamine oxidase, which helps break down histamine to an inert asymptomatic form, which is histidine. So if that is not functioning when you eat something that is high in histamine, you get a big histamine load in your body and you get all the symptoms from it: brain fog, fatigue, tachycardia, flushing. So it is tied to what you eat. Whereas in mast cell activation syndrome, it is triggered by, it can be triggered by food, but it isn't always. In fact, there's a lot of other triggers there as well.
So is it safe to say that if you want to know if you have histamine intolerance or mast cell activation, if you want to do an experience and then basically you start taking DAO enzymes at each meal and your symptoms are still here, that means can you kind of safely eliminate that it's not a histamine intolerance issue then?
Probably. I guess it all depends on what you eat. Like I think diamine oxidase is a tool. I don't think it's a cure.
Yeah.
And I'd say that if you eliminate, I mean, I'd say if you eliminate, what I would do first is kind of lower your, like, I would start being methodical about a low histamine diet.
Yeah.
Because you want to do things without medications if you can. But I think there's so many ways to go about it. And this is where it becomes fun because it's more art than science. And so I have this conversation with people and if like, I think this is histamine intolerance. There's a couple ways to go about this. One is you eliminate histamine from your diet, which is easier said than done. This is not a walk in the park. It is a tough diet to follow.
I've been doing it. It's really hard.
Really tough, right? And so you're eliminating a lot of key awesome foods like tomatoes, avocados, but it's also the way you prepare food. So leftovers, which are, I mean, I'm the biggest next day pizza guy of all time. And so that's going to that's going to be a huge histamine load. So leftovers are notoriously high in histamine.
Yeah.
So, yeah, so you can either do that or you can do a trial of diamine oxidase. But I'd probably couple them together because I do think if you ate a huge histamine load, I'm not sure diamine oxidase can still kind of can metabolize all that huge histamine, the huge amount of histamine that you ate. So I think it's probably a balance there, but the diamine oxidase trial is certainly a valid one to try.
Okay. So how it kind of like is a similar question, but how can someone safely identify at home if they either have mast cell activation or histamine intolerance? Like, so they've gone through every doctor, they don't know, they have similar symptoms that you've described. Before going to see you, for example, and says, okay, I think I have this, is there any way for a random person like myself with no medical degree to be like, I think it's this, and maybe have little experiences apart from going on a low histamine diet for like a few weeks and see if your symptoms are better? But if they're not, then you're like, okay, well, I know it's not a histamine issue. And then, so it's just what, reducing their daily toxic load?
Yeah, I think so. The question is like, okay, so how do you get to a diagnosis? And do you have unexplained symptoms in multiple body parts that can't otherwise be explained by anything? Um, do really fragrant things bother you? Are you really sensitive to medications? Do random things that otherwise shouldn't bother your system really kind of throw you through a loop? Like when it gets too hot out or it rains out or you travel and or you go on an airplane, you go in a hotel and all of a sudden you get flushing and fatigue and brain fog and everybody else seems to be doing quite okay. Those are really key parts of the history that make me think mast cell is at play.
Okay.
Uh, to your point, if you are concerned that you have histamine intolerance, then taking a DIO is kind of a nice proof of concept.
Okay.
If you are worried that you have mast cell activation syndrome, I'm going to say this out loud, and I've gone back and forth as to whether this is responsible or not, but I think it is try a medication to see if it makes you feel better. And so what you can do is you can try histamine blockers to start.
So like Zyrtec and all that stuff?
Yeah, and I try one at a time and see if it makes you feel better. But when I see people in clinic and I start them on histamine blockers, which we do for the right person, I always say there's a huge range of outcomes that can happen after this. I have people in my inbox that say, I'm thinking clearly for the first time in years. And I have people that say, are you sure you know what you're doing? Because I feel worse.
Mm.
And so, because people can have idiosyncratic reactions to the Pepsid, like their mast cells don't like it, and it's usually not the Pepsid, or the Zyrtec, it's the chemicals in there, like the additives. Because if you buy famotidine and you look it up on a website called Daily Med, there's famotidine, but there's also about 8 other things in there that help keep its shelf
Yeah.
stable. So I encourage people to kind of try some things on their own because these interventions are quite frankly really, really safe. And I will do it one at a time. I start with like Pepsid 40 milligrams twice a day, which is pretty big dose, but quite frankly, doesn't really have any side effects. Doesn't alter the gastric pH or the ability to absorb nutrients over time. That's always a question that I get. And do that for 2 weeks. And I track your symptoms very diligently. Everything from the brain fog to the fatigue to the tachycardia to the flushing to the itching. And then if that doesn't work, then try an H1 blocker. And sometimes you have to layer those two. But H2 blockers and H1 blockers are kind of can be really helpful. Here's the rub, is that when you treat mast cells, so here's the mast cells. You can either use medications to stabilize the mast cells, which we haven't talked about.
Yeah, we will.
Yeah, we can work on the environment or the milieu that's causing the mast cells to be angry, whether that's mold or stress or food or I don't know, a friend that bugs you too much, and you can focus on that, or you can block the chemical mediators that mast cells secrete. So histamine blockers just block the histamine that's being secreted. So if you don't feel better on that, if you feel better on it, great. But if you don't, I wouldn't say that's a negative proof of concept that you don't have mast cell. It just means histamine's not your problem. And it could be from the other 1,200 plus chemicals that mast cells secrete. And then you talk about maybe using medications to stabilize the mast cells themselves.
I see. I see. I hear a lot like quercetin, nettle, and vitamin C being like the big histamine, I guess, like that these chemicals or like these plants help a lot with histamine issue and possibly mast cell. Like it's more of the natural path to it. I've been taking it personally. I don't know if I see a huge difference, so that could be it's not a histamine issue. But how do you feel about like quercetin, vitamin C, like all these blends that are mixed together? Do you think that they're effective, or is it kind of like if it works for you, it works for you?
That's it. I think of them like any other therapy in mast cell. Who knows?
Yeah.
So I treat mast cell based on who you are, what your symptom profile is. But there's a huge degree of randomness to this.
Yeah.
And So quercetin is a polyphenol. Is actually the weak. There's a polyphenol that's actually stronger that's called luteolin. But there's a, if I were you, I would have, yeah, I think it's great that you went out and tried these things. I would have tracked your symptoms really, really carefully after about a month on vitamin C. And it's like, if it's not working for you, then give it to a friend who has scurvy or needs vitamin C.
Yeah, the carnivore
And if
friend.
Bingo, right. And then, or if you have your own quercetin, I would have tracked that very carefully to see if it's making you feel any better because it's really finding the unique kind of pharmacologic approach for your mast cell mutation, which we cannot decipher. So the best way to treat mast cell is to screen you for the mutation that you've incurred and then use a clinically proven medication to treat that mutation. We have neither technology. So it is when I talk to people, I'm like, I'm guessing here. I do this all day, right? So I think I'm pretty good at it, but I mean, we have to expect it not to work, like, or we have to plan for that. And I always have a plan B, C, D, and E. And my algorithm is 100 pages long of how we approach mast cell therapies. And I start with everybody kind of in the same place. I start with histamine blockers because they're super cheap. They can be really effective for people and really don't have any side effects. And what's tough in this world is that like you're super young, man. And so if I was seeing you, I was like, the reason I like Pepsid is because it's like $8, and we have to create a plan that's going to work for the next, God willing, 5 decades. And if you take these supplements, they're expensive.
Yeah, they're expensive.
They're not any better than anything else. I will say that, when I meet people, some people are like, I just don't want to take any pharmacotherapy. Like, I just don't want to. And that's totally cool.
Yeah.
We'll always meet you where you are. Um, but yeah, so I guess it's like there's no one size fit all approach.
So that actually leads to the next question perfectly, which is, can a physician test? Is there a specific test for mast cell activation syndrome? That like a blood test or stool test, any type of test that you can perform, and then you have here you tested positive for mast cell activation syndrome? It sounds like no.
No, there is.
There is.
And I run it, but I run it for research purposes, because I'm collecting data and I just want to help solidify symptom profiles that respond to certain medications. But I always hesitate ordering them
Okay.
because it's negative. I don't want people to get discouraged, right? Because these folks have dealt with decades worth of symptoms with negative test after negative test after negative test, told that it's okay, that it may be in their head, gaslit, and another negative test. I don't want to create additional anxiety. When truth be told, I mean, I'll tell people just based on the story, I think this is mast cell activation syndrome because again, nothing sounds like it. Nothing behaves this way.
Mm.
And I do screen people for other conditions that can do this. Pheochromocytoma, you know, neuroendocrine tumors. Like I look for these things as well that can cause similar symptoms. But I tell people that I'm going to order these tests, but if it's negative, it doesn't really change what we do. Look, if there's a point in time where the tests are negative and we try therapy after therapy after therapy and we're truly not getting anywhere, then maybe it's time to consider an alternative diagnosis. But yes, there is objective data. I am not beholden to it though, because I can talk to someone for 20 minutes and get a sense of whether they have mast cell or not.
Okay.
Again, there's nothing that behaves this way. But do you want to talk about the testing? Would that be helpful?
Yeah, I mean, just basically, you can go if you don't mind going a little bit over what the test is, but it seems like the way I'm hearing it is it's not really reliable.
Yeah, it's a coin toss, I think.
So why do it?
I think one is some people want validation, right? So it's nice to see that positive test to be like, this is it.
This is
I
it. Yeah.
got it, right?
Yeah.
Like that's cool. Sometimes there is an MCAS-ish story where it's like, there's some features here, but it's not totally classic. So I'd like to get some data. And then it's if it's negative and we try 6 different therapies, you're not getting better, like, do we need to dive deeper into something that we haven't yet? Like something really, really ridiculously rare, that I don't screen for up front because they're so ridiculously rare. So that's the reason to do it. So the reason why the testing is inherently fallible is that we're looking for the mediators of mast cells. So these chemicals that mast cells secrete, all right? Their half-life is like variable between 5 and 30 minutes. So it's catching lightning in a bottle.
Mm.
Okay. And so that's why it's so tough. And when you do these tests, they also have to be done well. And what I mean by that is that the lab agency has to run it the right way. So they have to kind of put the blood on ice. The urine it's a 24-hour urine collection that we do as well. That has to be kept cold, because if you don't keep them cold, those mediators they're gone. And so that's a key piece here. It's not only that they don't last very long, but they can be mishandled if not, if the lab doesn't know what they're doing. And so, but yeah, so the testing we run are, the blood test. Tryptase is the most commonly used one, but I'd argue, the least sensitive. So isn't positive a lot. Plasma histamine is a decent one. Chromogranin A. There's a couple 24-hour urine collections as well. N-methylhistamine 2,3-dinoprostaglandin F2A and leukotriene E4. And those are the labs that are more commercially available that you can find at LabCorp and Quest. And there's more esoteric labs that only go to specialty labs, but I rarely use those.
I'm assuming it needs to be a doctor who prescribed those tests, right? You can't just go in and test yourself.
Yeah, I think you need to have someone write for it.
You need someone, yeah.
All right, so there's a test. It works sometimes, it doesn't. Seems like your favorite part, or your favorite way to diagnose this, is just more like conversation and like get a little bit a better idea of how the symptoms behave in someone, and this is kind of like how you get. And then
But that's how it should be for everything, man. Really, like we've lost the art of talking to people,
Yeah.
and understanding what's going on. And that's what I did in my old when I now I see all mast cell and people with POTS and functional stuff but when I did see more bread and butter GI, I mean, the story tells you everything, man. The patient, the person will tell you what's going on. You just have to listen. And then the tests just, but no test is perfect, right? There's no test is 100%, even an MRI. I mean, MRI is pretty darn good, but no test is 100%. So you have to be ready to say, okay, there's something called pretest probability. It's based on your story and your physical exam. This is the probability that I think this is going on. And then we'll order some tests. And again, no test is perfect. There are false positives, there's false negatives, right? So when you order that test, you have to say, okay, now I have this data. Does this make me more confident, less confident, or doesn't really change how we think about what's going on? Yeah, you just have to, a lot of data points. It's always tough to know how to put them together. But yeah, so we've lost the art of talking to people and listening to the story, because that is the most important part here.
Yeah, that's I've told you that already, but I'll share it for the listeners. But I think I'll always remember going to the rheumatologist for like my third time, a new one at UCLA, young guy. He looked at my fingers and he was like, well, it looks like rheumatoid arthritis. We're going to order a test. Then I came back, did the test. My RA was negative. He was like, well, it's negative, but it's still rheumatoid arthritis. So I was like, all right, so the test, whether it's negative, positive, it is. But he didn't listen, because I told him prior to coming to see him, I did the test, and then I saw him a month later. I did a 3-day water fast where I didn't eat anything. And on day 4, I woke up, all my inflammation was gone, completely gone. Like, I was dependent of cortisone. I was taking 80 milligrams of cortisone daily to be able to function. I stopped taking cortisone. I hopped on a 3-day water fast, which was the hardest thing I've done. And then on day 4, no inflammation. And then slowly, as I started eating again, and at the time we'll get into that, but at the time I was heavily vegetarian based. I had like just a little bit of meat, and it was just like nuts, seeds, vegetables, a ton of it. My inflammation started coming back. And I remember telling him that. He completely dismissed it. He just went like, well, not eating for 3 days is not healthy. Let's get you on those meds as soon as possible. And to me, it was just like, how is that not valuable information, that when I don't eat, I don't inflame, like I don't swell up? So this is what had me start going into more of a holistic approach and reading all the books about gut. But this is when I was like, oh my God, there has to be some gut component to what I'm dealing with. That was my initial thing, right? And then in the last 2 years, I've started looking more into mast cell activation. But it just ties back to what you're saying about listening to the story. And because when you as a patient tell your story, you feel crazy. I told you my father's an ortho, and so he doesn't do anything that is immune system related. But when I tell him those things that I'm noticing, he looks at me like I need to get interned into a psychiatric ward. Like he's like, you are crazy. But I'm like, no, I feel it. I know it's true. I've experienced it, you
Yeah.
know?
And I hear this story every day. And I do give grace to doctors because we weren't taught about this. And
Yeah.
you not, so there's a couple layers to that. One is that, you know, you do a lot of training,
Yeah.
right? And you come out and you feel like, I got this. Like I kind of know what's going on here. And then someone like you walks through your door and you're like, what the fuck? What is this? Like, what does this even mean? It doesn't fit into any, like you kind of have categories in your mind. There's like
Mm.
infectious, there's autoimmune, there's metabolic, there's cancer, right? And then there's like this, where it's like it crosses so many organ systems. We also weren't taught about diet either, right? Like, so we don't even know how that plays into it. Like water fasting doesn't even factor into like a data point. Like, you don't even know how to interpret that. So people with mast cell break the paradigm of traditional medicine, where it's like, well, you're a rheumatologist. Like, now just talk to me about your joints. Or if you go to a GI doctor, you're like, well, I have this brain fog as well. You're like, I didn't ask you about your brain fog. I asked about your poop. Like, I'm here to talk about your poop. And so, and so there's no construct to understand these patients. And that's why, and doctors only have a few hands to play, surgery, medicines, right? Um, and uh, but truth be told, this condition is a product of our times, and it needs to have a holistic approach where you take everything into consideration from. And yeah, I use medications all the time. I think it's really tough to control without medications. I really, really do.
Well,
If someone
that's
doesn't want to take it, if someone doesn't take it, by all means, like I'll meet you where you are, and we'll 100% try to figure this out. But well, I know we're going to talk about it, but like I try to, I'm as candid as possible with medication, side effects, cost. I also think that like on everything in medicine is a cost benefit analysis, right? Like do the benefits outweigh the risks? And I got to think that ongoing mast cell activation is not a good thing. And medication that can calm that down if they're safe enough is probably move in the right direction. But again, it's not for everybody.
Yeah, I mean, and to finish on the fasting, like, um, it's not a convenient thing to do. It's pretty hard to do if you have a social life. And sometimes fasting can actually also aggravate the symptoms in some people because it just raises your cortisol level, which I guess there's a whole other chain of action right there because it just puts your body under stress because you're not eating. So I know that at first it worked for me, but then as I started fasting more and more, it actually messed me up more. So then I was like, oh, okay, this is not for me anymore. But we're
Yeah.
literally just exactly going on my next question, which is what about functional approach to treating mast cells? So you prescribe medicine, you also do um, a functional approach to it, which is one of the things too that I really appreciate with the way you practice medicine is that you're not an all or nothing person. It's not like you can only take this, you can only take this. It seems like the combination of both worlds seem to be what works best. But what is what's like what would be your approach into combining both? And when it comes to mast cell, when somebody has mast cell, is there a way to eventually get rid of it so that you're not on mast cell medicines your whole life?
So yeah, it's a lot packed into that question. So I definitely take a holistic approach. I'm not really sure what functional means to be. I'm a traditionally trained guy, I went to Duke.
oh yeah.
And I take a holistic approach, which is a whole body approach. So diet, stress, like that's because I do think you have to layer in all of these factors to get people healthy. Like the gut is more than just, what you can see on an endoscopy. It responds to everything. Like this, we know that in people who have like chronic GI conditions or GI symptoms, that their symptoms are worse after a night of poor sleep. So you have to talk about that. You have to talk about hormones. Hormones have a humongous role in how our GI system moves. So I do like to take everything into consideration. Um, you mentioned, is someone going to need to be on medications? I think so. I think so. But everybody's different. Like, so if you can cut out high histamine foods, we also find that a gluten-free diet can also be really helpful. That may make your symptoms at bay sufficiently to not need anything else. But I do think as long as we're in this environment, it's tough, right? Like I have a patient whose mast cell gets pissed off by the electromagnetic frequency on the phone. What is he going to do, right? You can't escape this world that we live in, right? The paint on the walls, the pesticide, like you it's tough. I think this is a product of our times. And so it's immune dysregulation, right? Let's call what it is. It's immune dysregulation. And sometimes you need medications for it, but I don't force it on anybody. Like it's called shared decision making, where I say, I don't know everything about this. I think I know a lot about it, but I think the book is yet to be written on it. And this is what I know about it. And this is how I see people get better. Now, taking this into consideration, how do you want to get better? And where can we meet in the middle? Because when someone becomes like a non-compliant patient, which means the patient doesn't follow the plan, that means the doctor made a dog shit plan, right?
Yeah.
Because they didn't listen to them, right? Because they try to enforce what they wanted or what they thought was best for the person without taking into consideration. Sorry, I cursed. I don't know if that's appropriate or not, but
Oh, yeah, you're good.
it's been a long day.
Yeah.
So it means that they didn't, and I've done it too. Like I've had patients who are like, "Yeah, I know we made this plan. I didn't do it." I was like, "Well, that's my fault. I'm sorry. I didn't listen I didn't listen well enough." And
Mm.
sometimes we miss things. And that's why. And so the answer is, does someone need medications? No, like it's not cancer, right? It's not going to kill you. Where it's like,
Yeah.
okay, chemotherapy is going to be a really big game changer here, but could it lead to increased quality of life? Yeah. And so I will always tell people like, this is kind of what I would think about like your symptoms and what I would try. Does that resonate with you? Is that in line with your moral and personal compass? And if it is, great. If it isn't, let's try something else.
Yeah, it seems like the in today's age, the narrative around medication is that it's just a band-aid to remove symptoms. Um, and people who I think have been dealing with autoimmune stuff or issues for a while, they go through the phase of just putting like a band-aid on, but then eventually they just want to kind of like cure the cause, right? So for example, um, I know for a fact I can start taking cortisone and I'll be doing fantastic tomorrow for sure. But I also know that cortisone in the long run has issues, like has severe side effects. And so I think people are worried about the long-term side effects or the long-term consequences of taking a medicine for a while. So what is the traditional kind of medicine for mast cell activation syndrome? And is there a world where people take it for maybe 5 years and then get off of it because it just kind of self-regulated itself? Or do you see in your practice typically that once you start taking them, you kind of need to take them all the time? Or is it just there's no straight answer?
It goes back to the philosophy of mast cells. They're reacting to something. And so you're just calming down their reactivity with medications. So if you can get at what they're reacting to, then you don't need medications. I do feel that they're reacting to the environment. And that's why people move.
Yeah.
I had two patients move to France in the last 3 months because I feel so much better there. Right.
Wow.
And so they don't need medications in France, but when they come here, they need medications to get by. So again, it's a balance, and a medication is just the tool. Like that's all it is. And as long as you know what the tool is for, right? And you know the side effects, then it's up to you whether you want to take it or not.
What
We won't always know the root cause of things. We just won't. There's conditions like ulcerative colitis, Crohn's. We don't know the root cause of it. It has something to do with the environment, right? These weren't around 150 years ago, but something has changed in our diet, our stress levels, technology. Like there's so much that has changed that are inciting these autoimmune things. Like, is it because our microbiome stinks? Because our diet isn't great? Is it because we're always stressed? Is it because we don't move enough? Like there's so many variables here. But there's not a test that really show that. But if we go back to mast cell, I do find that, if you are on a medication and it makes you feel better, people say like, will I be dependent on it? I'm like, what does that mean? Does that mean that when you come off it, you feel worse? Is that dependency, or is that just the medication helps you feel better?
Mm.
And when we talk about medications for mast cell, I mean, I've used so many therapies in the last month, everything from medications that have been shown that are typically used to prevent liver organ transplant rejection, because someone has a huge autoimmune component. So we have people with like really bad autoimmune mast cell, which means they have all their autoantibodies are positive and they have joint pains and fatigue. and we can't figure out what's going on, then we use immunomodulators. Like that makes sense for them.
So this is like methotrexate.
Plaquenil, methotrexate, Prograf. Like there's people that have horrendous autoimmunity,
Yeah.
and they can't swallow, and they have all these positive autoantibodies, and it's just really, really tough. We use IVIG. Look, those are extenuating circumstances. But we use medications to, again, to kind of go back to the paradigm is we can try to control the environment to the best, like that's the way to get you off medications. So I always give people as many levers to pull as possible, whether it's diet or kind of instructions about the environment to not be on medications. But yeah, so the medications, we can use those to help block the mediators that mast cells release, like histamine blockers. There's also leukotriene blockers. Those are typically singular. That's used for asthma. And then we use mast cell stabilizers. So you were referencing quercetin, which is a polyphenol. So there's a group of polyphenols that work really well as mast cell stabilizers. Rutin, quercetin, luteolin, high dose vitamin C. I usually do about 500 to 1,000 milligrams extended release. If you have kidney stones, you can't do that. But everybody's journey is different. And so I usually start in the same place with people with like histamine blockers, maybe some polyphenols. And then based on your response or lack thereof, we move in different directions. So I have some people that I put them on any medication and they react to it. Like they're that reactive. Any medication they take in my mouth, they feel terrible, right? So then you have to use like an injection, right? And like omalizumab or Xolair. So it gets kind of wild. And everybody's journey is different. And it's up to them how they want to feel better. And I just try to give them the roadmap.
All right, so there's not one straight medication.
No. So there's probably like 30 different therapies that I have in my armamentarium. But like L-theanine is a really nice one too. Like metformin is one that we use for diabetes. So if someone has polycystic ovarian syndrome and metabolic syndrome and prediabetes, like metformin is a nice option. Low-dose Ozempic, like microdose Ozempic, can really help for some people. Not for everybody, but for some people. So it all depends on kind of what their symptoms are, what their comorbidities are, and what their preferences are. And I do my best to meet everybody halfway, to get a sense of how they want to be healthy and let them drive the ship. And I'm just in the passenger seat or the back seat, just being like, hey, like maybe you want to like just this is the roadmap, and you're driving the car, and let me know how I can help you.
Okay, is it safe to say that diet on top of obviously environment can play a role into managing mast cell?
Yeah, I always have a really tough time with the diet. I have this conversation with everybody, but admittedly, I have a really tough time having this conversation because there's no data behind it. And to be fair, clinical trials around diet are really, really tough to implement and study. But I meet everybody at various parts of their mast cell journey. So I've met people 10 years into this thing, and the story and the narrative that I hear over and over and over again is that they cut out high histamine and gluten and they feel a lot better, mainly from a neurocognitive perspective. The brain fog, the fatigue, the joint pain, some of the GI stuff like bloating gets better too, but not for everybody. And so it's an option. And some people are like, there's no freaking way I'm giving that up. And that's totally all right. Like if that doesn't make sense for you, if that kind of risk benefit calculation is not in the favor of making these changes, then by all means don't do it. I just want to give you options. And so, but they're really, really restrictive, as you know. And so, do you want to take on both? Do you want to do one at a time? But I always want to track your symptoms very closely just to make sure this is the right move for you. Because some people do it and they feel no better. Like I've been on the gluten-free diet and I feel the same, I feel as bad as I did when I wasn't eating pizza and going through the headache of doing the gluten-free diet. And so when I either recommend a pharmacotherapy, supplement, a diet, I do track everything carefully to make sure you're not doing anything unnecessary. Because I do find I have people that come to clinic who are like 18 different supplements because they're just trying to take crack at this thing. Like maybe this will work, maybe this will work, maybe this will work. And I do think being strategic and methodical is very, very important. So you can feel the best that you can while being on the leanest medication regimen and having the most liberal diet as possible.
Yeah, I mean, supplement, like I went through that phase from going to a functional doctor, and I must have had like 20 supplements to take a day. It's expensive, and after a while, to me personally, it felt wrong putting so many synthetic stuff in my stomach when I'm trying to heal my stomach, like my gut. Like it just feels off. Like I'm gonna take some made lab little powder to It's just so I am off all supplements now, but
And I have my own thoughts about supplements. They're not any more benign than the medications we use by Big Pharma. Do I trust Big Pharma? Of course I don't trust Big Pharma. You kidding me?
Yeah.
Do they make medications that have been clinically studied by good people and scientists? Yeah.
yeah, but not supplements.
Right. And so when we talk about things like Pepsid or even PPIs, which we don't use in Mast Cell, like we know what they do and what they don't do. We know what, so I have so much like, but quercetin, it's not well studied, right? Is it safe? Probably really, really safe. But supplements, not only are they costly, but they're not FDA regulated. So I don't even know what's in the frickin' thing. And they haven't been well studied. So
Yeah.
I get the big pharma hesitancy. I don't like taking medications either, but we do know what they do and what they don't do.
Yeah, there's more research, and when you take your quercetin supplement, you don't know how much quercetin is actually in there, as opposed to just going and taking the actual plant. So
I can make a quercetin supplement, right?
you can put just fillers in there.
I could put it on Amazon, right? No problem. Like I don't think Amazon is yet. I think they're going to start screening to make sure that what medications and supplements, what they advertise is what they actually do, or what they have in it. But I don't think it's that locked down right now. So yeah, I'm always wary about supplements as well. So
When it comes to, so, we're briefly talk about diet, and it seems like your approach to the diet is that it's highly individualized. Some people might do better on this type of diet. Some people might do better on this other side, on this other type of diet. And then, that you try to lean for the least restrictive, just so that people can have like a easier life. I know I have experimented with diet for the last 4 years, from being 90% to 95% vegan, to then going vegetarian, to then reincorporating meat, to then doing the China study diet, which is like 3/4 of your plate should be vegetables and 1/4 should be meat, to then going on a low fiber diet, which is actually when I started to finally feel a bit better, to then removing most of my fiber from plants and just keeping fruits, to then going borderline carnivore, to then not feeling too good with carnivore, to then realizing that, okay, I feel the best and it's the easiest for me to maintain when I have lots of meats and animal product. That seems to work really well, at least for the moment. But I still have fiber in my diet, from the form of fruits, because I genuinely enjoy fruit. I crave it. And I try to stick to low histamine fruits. And then the big debate on vegetable right now that's going on, I'm like, I'm only going to eat the one that I genuinely crave and that I enjoy, as opposed to forcing myself to eat vegetables because they're supposed to be healthy, when it seems like, we're going to get into the whole carnivore thing, but like, and so one of the questions that I have is fiber. It's a big debate right now, at least in my feed, and I see both extremes. You don't need fiber. Fiber is a scam. Humans don't digest fiber. It is indigestible. You do not need it. Huh? It's not meant for you.
Not meant for you. It's meant for your microbiome.
It's meant for your yeah, but the microbiome. But then their argument is the microbiome will feed on whatever you give them, and they can feed on amino acid from the meat. And the other end of the spectrum, you need to get at least 100 grams of fiber a day, and you need to be pooping 3 times a day. Otherwise, it's not healthy. So one of the things personally that I think, from taking a step back, is that extremes gives views.
Wise man avoids all extremes.
You're going to get more view if you're super extreme and you say the most horrendous stuff, like, you don't need it. Or you say the complete opposite. I have a feeling from how we've been talking that you're going to be right in the middle, and that it's kind of like individualized. So for example, I have a feeling that some people do really good with more fiber. Some people do better with low fiber. Some people do better with no fiber. Some people do better with a lot of fiber. In my experience, I tend to do good with low fiber. Too much, I'm bloated, I don't feel good. Not enough and too little, I feel off as well. What's your take on fiber? And does your own personal microbiome play a role into how much fiber you can actually handle?
I'll preface it by saying that I'm not a microbiome expert.
Okay.
But I do think fiber is important. I think it's really important to help you poop. Um, I think people who are void in fiber probably have a tough time going to the bathroom or have diarrhea. Because what fiber does, it helps increase your colon transit time, and it also helps you get bulk to your stool. So if you're not, it's kind of like so soluble fiber works as a sponge. If you ever put like Metamucil in water, it just kind of blows up into one of those like, like kind of those toys that you put in the bath and they kind of become a dinosaur. My kids have them. But yeah, so it turns into a sponge and it really soaks up stool to give it kind of that nice bulk to it. I will say that most people that I know that have done carnivore have gone back at some point in time to incorporating at least some part of some fiber into their diet. Um, because they feel better. Like it helps them poop. They feel less bloated and congested. Um, but I guess it all depends on why you're making these dietary changes. Like, what's your goal? And I think that if you're really, really bloated, is adding more fiber to your diet better? Probably not. And also, you have to figure out why you're bloated. So it all depends on like what question you're trying to solve, right? Are you trying to solve some kind of mystery illness that you had, right? Then it's important to identify what that mystery illness is and what diet works best for it. Um, I work best with a little bit of both. It also like because are you saying are you is your goal to poop better? Is it to feel better? Then a lot of it depends on like, you know, goodness, your microbiome, your hormones. Are you male? Are you female? How long is your colon? What's your inherent motility like? There's so many inputs here. That's why protocols don't really work.
Mm.
You really just have to listen to someone and get a sense of what makes them feel better, what makes them feel worse. And if you say you eat a lot of meat and you feel worse, then like, why is that? Is it chicken? Is it pork? Is it steak? Is it the fat content? Is it how it's made? Right. So you have to ask all these questions. And so I think you have to do investigative dive into why certain foods make you feel better or worse, and will lead you into it will help guide you into the best diet for you. So again, I think a wise person avoids all extremes, but some people feel better on a vegan diet. Like, why is that? I don't know. Is it their hormones? Is their microbiome? But I don't think you can say one diet is better than anything else. You have to say, okay, who is the person? What are their goals? And then tailor the diet to them.
That's whenever you look into autoimmune stuff, you'll hear stories of people healing off a raw vegan diet and be like, oh, I did it for like 6 months and then all my issues went away and I'm back to eating normal. But then you also hear people healing from a carnivore diet, just meat, eggs, and water, or just meat and water for like a few months.
Why did they get better? Was it incorporation of those foods or was it elimination of the other foods? And was it elimination of all things vegetables? Or are there certain things in there like avocados and tomatoes that were really high histamine that really bothered you, right?
Yeah, yeah.
Is it so I think it's probably best to do both. I don't want to tell anybody what to do though, because if they say, hey, I eat eggs and bacon and meat all day and I feel wonderful, like who am I to say that that's not the right thing to do? I think we have an incomplete understanding of what's going on in people's bodies. But you can't compare Janet's experience from Minnesota with Julian's experience in California. Like you have categorically different bodies, immune profiles, hormone profiles. And so I really think you gotta listen to someone and try to make sense of their narrative in the context of who they are, what makes them feel better, what makes them feel worse, what are their goals, what hurts, what doesn't hurt. And if someone tells me that they eat meat and it hurts, I have a couple questions, right? Is it mammalian meat, right? Do they have alpha gal? Is it really fatty cuts of meat that would implicate something like gastroparesis? Um, is it, yeah, really fatty cuts of meat and they get diarrhea, which makes think they have like bile acid malabsorption, or do they have a pancreas insufficiency? So I think you have to get a sense of like why they feel crappy, what they're eating, what symptoms do they get, and then when they move away and incorporate other things that may make it feel better, why is that, right? There has to be a why. And that's why protocols drive me crazy because no two people are the same. And yeah, it all starts with listening to people and understanding physiology. And if you marry those two things, you can go a long way.
The all these protocols and these diets, even like the AIP, the autoimmune protocol, I think they're meant to remove most of the known reactive food that creates some sort of reaction calm down the immune system for like anywhere from 1 to 3 months, and then you're technically meant to be starting reincorporating one by one. So people on the carnivore, unless the people that have been doing it forever, but like most people will use carnivore, my understanding, as a tool to remove everything for a month, see how they feel, and then eventually start reincorporating a food one by one to see what caused the trigger. So it's a way to do it, which might be easier than just eating a lot of different stuff and not being like, oh, I don't know what's causing this and all that stuff. So it seems like the answer to that question is just, again, you have to try it for yourself and see what works. And there's no real one size fits all kind of, because when you talk to, like, when, I listen to a lot of carnivore people, and when they talk about plants and they say plants have defense mechanism, defense chemicals, phytonutrients, anti-nutrients that will preserve you, that preserve you from absorbing all the minerals and nutrients that you need. And because of that, and like plants in the wild will kill you if you don't cook them first. So they're not meant to be eaten by humans. And
That's an extremist take, right? That's pretty crazy, right? That is, so I eat salads every day. I think I'm doing pretty well, right? And so
Yeah.
I also like salads, right? So what is it actively destroying me? No way. Like, they can't actually, I mean, but that person comes from experience, so they eat a lot of meat and they feel better, right? But there are people, freaking Tom Brady, Chris Paul, right? They were on a vegan diet and they're national champions. Are these berries and defensins ravaging their system? I don't think so. It makes them feel good, right? Because they're a categorically different person than that. So I don't think you can apply that logic to everybody. Like, I'm going to put him on blast, but Paul Saladino wrote a book about this stuff, right? And then he came out and said that I felt horrible on it a year after doing it, right?
Yeah.
Doesn't mean it doesn't work for some people. You just can't paint with a broad brush. I'm sorry, you can't. Like, I
Yeah.
see people from all, and so the people that will say it's all or nothing, I don't think, listen to people's stories like I do all day. Like, I hear people's stories all day. I hear people get better on carnivore. I hear people get better on vegan. Everybody is so different, right? And you have to, like, and I think in terms of identifying what the best diet is for you, you have to say, get it, like, work with someone to identify what the underlying process is. Like, if we work together, I'd be like, dude, this sounds like mast cell. And generally speaking, this is what works best for people. But if you're dealing with an ailment, you have to identify what that is, right? Is it stress? Is it your pancreas? Is it your intestines? Is it your stomach? Is it your colon? And then what diet buttons can you press to start feeling better? But it's never, you can't apply these kind of logic to everybody. And no, plants aren't going to destroy your system. Like,
Yeah.
people have been doing just fine eating vegetables and fruit for years and years and years.
yeah, the whole like plant stuff is always to me about, because I'm like our ancestors that lived in Antarctica who didn't have any fruits and vegetables, sure, they thrive on just like animal products, but we also have ancestors that lived in a tropical island that probably had access to tropical fruits all year long and that were eating it, and yet here we are. Now we're like a combination of both.
I think your body adapts.
Your body adapts. Now I will say, it's, a lot of people give Paul Saladino some heat for like writing about the carnivore, making it, and then switching it. I actually respect the fact that he was able to go back to his thoughts, say, I did this for eczema for a year and a half. It helped me heal my eczema because it seemed like that was his main issue. But at the end, it messed me up. And I actually respect the fact he was like, now I'm incorporating lots of fiber and fruits, and he's constantly kind of monitoring how he eats. But it's true, he wrote a book on carnivore saying that's the way.
Right, but it was an all or nothing take.
It was, yeah.
It was plants hurt your system. Broccoli, kale is BS, is what his nomenclature was. Kale makes a lot of people feel great, right?
Yeah.
And so that's why Paul is doing what's good for Paul's body, which is awesome. I applaud that. But you can't write a book without, like, you have to see patients, right? You have to work with people. And he didn't have that clinical experience to do so. He was a psychiatrist, and I would never kind of dabble in the psychiatry world. But if you're working with people and applying what he knows to diet, and he sees over and over again that this works for a lot of people, then fine, publish that. But when you are publishing a book about your own experience, which is not invalid, But then saying these things hurt people because it made me feel worse, like that's not okay. That's you have to provide some guardrails there, right? It's like this made me feel better. It may not make everybody feel better. And maybe he said it and I missed it, but coming out and saying kale is BS and wearing that shirt is not a helpful statement.
He's definitely changed his stance, and he'll start his videos now on saying, listen, if you feel great eating the way you do, then that's great. Don't change a thing. But if you have this issue, try this, try this, try that. I think you do bring a very important point, is that for us viewers who are on social media that look at all these different doctors, whether it's Paul or there's a lot of doctors that are very big on social media, big influencer in terms of the health space. But it seems like a lot of them, what they don't do is see patients daily, which you do, right? And so you get to see the day-to-day struggle of people. Whereas, there's we've talked about this other doctor who is a big fiber guy. I don't think he genuinely treats patients either, and he's out here saying like you need 100 grams of fiber with his little experiments.
And it's
Some
just
people
like,
feel horrible on that.
Yeah, exactly. So it's not an all or nothing. So
And if you have slow motility, right, there's so many, you really have to understand what someone is going through. Is it an autoimmune thing? Is it a motility thing? Is it a microbiome thing? Is it an antibiotic thing? Is it a stress thing? And then work with people. And that's where it's like you just have to listen to, I listen to stories all day, Julian. That's
Yeah.
all I do is listen to people. And I've been doing that for years. And so I get a sense of like what buttons to press. And that's why, when you hear people being like, you have to do it this way, it's like, well, you don't know what you're doing if you're saying that. Or it's this, or you do know what you're doing and it's disingenuous.
yeah.
Because it really is, you have to tailor, everybody's unique.
Yeah, some of these stories, I was always told, eat your vegetables, eat your broccolis, eat your stuff. I personally, even as an adult, never liked, for example, broccolis and Brussels sprouts, but it was anchored in my head that I had to eat them. And one thing, at least, to see people like Paul said, some of these carnivore guys seem relatively healthy without ever touching a broccoli, made me realize, oh, maybe I actually don't need it if I don't enjoy it, and then sit in my couch because my pants are about to explode because I'm so bloated. So at least that was a positive thing. It was like, oh, okay, I guess you don't really need to do that, and you can focus on the foods that you genuinely like as long as you have a bit of diversity.
Yeah. I will also say there's a lot of doctors talking about diet and what they should do. We should probably listen to dietitians.
Yes.
We forget that that's actually their job. And there's a lot of doctors being like, you should eat this. I was like, well, let's talk to people that have studied this and do this every day. And we don't do that enough.
Yeah, the whole like studying too of diets, like I think people are losing trust because of everything that's happening, with the story with statins, when we were told that like statins was the key to lowering your cholesterol, and now it's coming out that cholesterol is actually good for you, like all these things. So it's like a lot of people now are losing trust into the research that was made, that was taught. But we're diverging on the subject. I want to come back to, so I had a few questions on like thoughts on carnivore diets, thoughts on vegan diet. I don't think we need to go into that because we kind of discussed it already. And it seems like, it's just whatever works for you basically, and just talk to your doctor and figure out. And even in my own videos, I always say, this is what I've tried. This is what it made me feel this way. Try it out and see for yourself, but it might not actually work for you. So it seems like that's your general approach to that. However, when somebody is dealing with an autoimmune issue, that I think it seems like a lot of autoimmune issue, I guess, starts in the gut. I'm not sure if you would agree with that. It would, so if you're dealing with autoimmune issue, is overall a restrictive diet just a good idea to just kind of minimize flares? And if so, is there something, I know you're not somebody who talks in absolutes, but is there a category of food or some category of food that you'd say, try at least cutting this out for a little bit and see if that makes a difference, because it can actually exacerbate any sort of gut autoimmune issue?
Yeah, again, it's lumping a very heterogeneous group of people into one group. So it's tough.
Okay.
Gluten is not great for some people. I could eat gluten all day. I don't have an autoimmune condition. But for the wrong person, gluten can be really, really bad.
Is it gluten or because I've been reading lately about gliadin?
I'm talking about gluten, the protein.
Protein, okay. Because in like there's also another thing that is found, I believe, in wheat, that is gliadin, right?
I don't know if they're one and the same, to be honest with you.
Okay.
We talk about like anti-gliadin antibodies when we look for celiac disease, and that responds to gluten intake. So I don't know how chemically they're necessarily different. But gluten seems to be pretty inflammatory for some people, and can cause joint pains, fatigue, brain fog, mood changes. And I don't know if it is weakening the intestinal barrier to where, causing quote unquote leaky gut in those who are genetically susceptible to that, leading to like the leakiness of kind of food particles and bacterial toxins causing kind of neurotoxicity. I don't know. But gluten is where I would start, to be honest with you.
Does that include gluten from soy, like soy sauce?
Yeah.
Gotcha. So all gluten, because that's a thing too. People go gluten free, they remove bread and pasta, but they have soy and oats, which most of the time are contaminated too with gluten.
Yeah, and I don't feign to be an expert in kind of subtyping removing gluten, but I do see that over and over again really helping people.
Okay.
And some people do really well eliminating FODMAPs from their diet.
Yeah.
I typically find those people who are struggling with kind of bloating and loose stools, FODMAPs can really be a helpful thing to eliminate. And there's kind of growing data to suggest that high FODMAPs actually increase the leakiness of our gut barrier, and that's maybe why people feel better being on a gluten-free diet. But I would work with a dietitian with this because, once you come off these foods, it's great and you feel better, awesome. But you also want to make it to where you're also enjoying your life to some degree. So can you add back some things and have in a safe manner? Like if you have celiac disease, you have to cut out gluten. That's it. It's an all or nothing thing. But in people who are gluten sensitive, is it an all or nothing thing? I don't know. There's no data for it. Is it binary? Or can you just reduce it tremendously and then add things back? And I think that's where it's nice to have some kind of guidance there to where, the low FODMAP diet, for example, some people start it and they never come off it and they never reintroduce things back into your diet. And that's a horrible existence. It's really, really tough. And it's not meant to be that way.
Yeah,
It's meant to, you eliminate it as a proof of concept to see if it makes you feel better. And if it does, then you add back things kind of one at a time at a low dose, just to find that balance between symptom improvement and enjoying life again and being able to eat some of the things that you really like to eat.
But if you eliminate FODMAP and you feel better, doesn't that, because again, eliminating FODMAP is a band-aid of just, I'm gonna eliminate this because it triggers some sort of reaction. Doesn't that technically means that you have an underlying gut dysbiosis or SIBO that tends to be worsened by, because I was told by my functional doctor, for example, that you have dysbiosis in the gut, and we're going to talk about the microbiome tests just after that. You have dysbiosis in the gut, you have X amount of bad bacteria that are basically out of proportion of the good ones. And when you eat a high fiber, high FODMAP diet, you're feeding into it, making your symptoms worse. So the reason why you do low FODMAP is to starve these guys so that you can have a more balanced microbiome, and then you're supposed to repopulate. What's your take on that? Because if you remove FODMAP and you feel better, does it automatically mean that it's because you have dysbiosis, or it could be completely different? It could be a completely different reason.
The question is, why do FODMAPs make you feel crappy? Okay, so if you have SIBO, it's going to make you feel not great. I will say that I have my own thoughts on SIBO. As someone who sees SIBO day in, day out, it gets way more hype than the trouble that it actually causes people. But so what are FODMAPs? Okay, so they're fermentable oligodimerinosaccharides and polyols. So these are non-absorbed carbohydrates. So they're meant for your gut bacteria. And they act as fast food for your gut bacteria, causing gas formation. And so if you are dealing with bloating, it may help because it's giving the bacteria less things to feast on. Okay. If you have SIBO, yeah, the bacteria are going to feast on these things and cause a lot of gas. Removing it won't make the SIBO go away. You have to be on like an elemental diet to treat the SIBO, but that's a really
smoothies.
conversation. That's more than just smoothies. It's really you're eating already digested food that can rapidly be absorbed into your intestines that don't require the facilitation of bacteria. So yeah, so you got to ask yourself, like, and so there's some people who have what's called visceral hypersensitivity, which is a bigger conversation, which is where they eat FODMAPs and they have pain. Question is, why do they have? But because that bloat. So if I ate a bunch of FODMAPs, I'm going to get gas. Like that's what happens with FODMAPs. The question is does it bother you or not?
It
And
bothers
so,
your girlfriend.
yeah, gas. Yeah, you having a Dutch oven at nighttime because
Yeah.
of it, or does it cause pain? Right. And so if it causes pain, why is that? Is it because you have a ton of stress in your life and your brain has a tough time tuning out those signals and it causes a lot of pain? Is there aberrant mast cell activity? Like there's nuance to it. So yes, the FODMAP diet is covering something up. Does removing does if you get better on a low FODMAP diet, does it mean you have underlying dysbiosis? Not necessarily. Um, But yeah, I mean, it's again, it's individualistic.
Okay.
But I wouldn't say that an improvement on a low FODMAP diet is proof of concept that you have small intestinal bacterial overgrowth or that you have dysbiosis. It can mean a lot of different things.
Wow, that's interesting. This is the first time I hear that. I was always told if you're bloated after food, if you do better on low FODMAP, it just means you have dysbiosis. You got to reequilibrate your gut, basically.
I don't, but things there's, I mean, it could be. We haven't studied that. And that's where functional medicine gets tricky because it's a lot of theory that hasn't been studied.
Yeah.
And so if you say, okay, with a low FODMAP, I get better on a low FODMAP diet. This must mean I have dysbiosis. So what? Okay. Does it mean that probiotics are going to fix you? No. Does it mean that you should still be doing all the right things to support a to support a healthy gut microbiome? Absolutely.
Mhm.
Sleep, getting outside, don't drink alcohol, eat whole foods. The answers are still the same. Okay. We don't have to overthink this stuff. And so what we do is we implement dietary modifications that may make you feel better, like a low FODMAP diet. Well, then while simultaneously supporting your system, do we feel like stress plays a big role in your symptoms? Then let's talk about it, right? Is that you're not sleeping at all? Why is that? Like that's going to predict next day pain and when you get bloated. Do you have SIBO? And SIBO, we need another 2 hours for
No,
SIBO.
yeah.
SIBO is overhyped and it doesn't cause nearly as many symptoms as people think.
We could actually do another one, whenever about SIBO, because yeah, SIBO is a whole thing, and it's also taken over social media. I know I just finished a book on it, did the protocol, helped me a lot, but it's true now. I'm scared of SIBO. So one of the main things about dysbiosis that we're told is to do a microbiome test, a stool test, and that will give you, a clear indication of how your microbiome is, and that based on the results, like a GI map test, you will have we will have the treatment that you will need to do. My understanding is you don't believe that these stool tests are very reliable.
Nope,
Why is that?
because they're not validated. So if you get your stool test done, okay, on a Monday, if you do that 2 weeks later, you're going to get drastically different results. Okay. Tests need to be validated, which means that they need to be reliable and reproducible, which microbiome tests have not been proven to this day. And the also question is like, what do we do with the information? Right. So I get microbiome tests on a daily basis. What do I do with this? Can anybody tell me? Because the way that the way medicine works, like good medicine works, is that you have a symptom or a diagnosis, right? You say, okay, well, I think this may be due to the gut microbiome. Let's say that, for example. I'm going to test their microbiome, okay? And we get those results back. And they say, okay, well, I found dysbiosis here. And this makes sense because I thought the symptom was due to dysbiosis. Now I'm going to implement certain measures to fix this. What measures are you going to implement to fix the microbiome? Probiotics, like we don't have any data to say that probiotics, we don't have, like if you have a microbiome profile and say that we trust that test, which inherently they're not validated, right? And so the way you conduct a study that to say, okay, fixing this will make symptoms better is we have this microbiome, I'm going to do XYZ intervention, whether that's diet or probiotics. And then we follow up in 6 weeks, 8 weeks, see if you get better. Okay, you're feeling better. Now let's test your microbiome to see if that change actually fixed your microbiome and that's why your symptoms are better. Because placebo is 40%, right? So when people try something, placebo, like the reason we do randomized control trials, we give people control or drug is because if you give people a placebo drug, it works. Like if people, like there's a real psychological element to a lot of things that we experience. Our brain is very, very powerful. Um, and so they haven't been validated. It's not necessarily actionable, right? I can't do anything to make it, well, I guess there's a couple things. Like say you have some symptoms, right? And we test your microbiome. Is your symptoms because your microbiome is like this? Or is the symptoms driving your microbiome? Like, so say I do this, like I do microbiome testing in MCAS, right? And I see a lot of dysbiosis. Is the dysbiosis causing the MCAS? Or is this inflammatory process throughout your body then driving the dysbiosis,
Okay.
right? We don't know that. And then say we have dysbiosis, how am I going to make it better? We don't have anything actionable that we know about, right? So probiotics don't stick. They're passerbyers.
Even fermented foods?
Fermented foods are a good source of probiotics, but like again, you're guessing, right? And so then why don't you just eat? And so again, I just don't know what we're doing here.
Okay.
And I see this a lot in functional tests where there are a lot of data points that I don't know are necessarily actionable. And if someone wants to come up here and challenge me on that, I'm all ears, right? But there's no science behind it. There's no clinical studies to say that, okay, well, we got this data. We have this person with these symptoms. I have this data. Now let's fix this with whatever tools that we have, and let's see if the symptoms get better. That hasn't been studied in microbiome testing. So because the data is inherently unreliable, I still preach the same thing. Stress management, good sleep, minimize alcohol, and a whole foods diet.
Sounds simple enough.
And,
I
and probiotics, I mean, there's a reason why clinical studies and probiotics are so fraught with confliction, right? They don't universally make people feel better.
Okay.
If they did, it'd be great, right? Like I think probiotics are amazing in theory. They just don't, it hasn't been borne out in clinical studies. Why is that? Is because we don't even know if the dysbiosis is the reason someone feels poorly. And do the probiotics actually work? I don't think there's any data to say that they stick. I think what the data shows, they will offer good stuff to your colons, short chain fatty acids, but they don't improve dysbiosis. So then what are your actionable steps to improve dysbiosis? Fermented foods, then great. Like if you are suspicious, then dysbiosis is causing your symptoms, then eat some fermented foods. Great. I wouldn't use a test to prove that or disprove that because the testing has not been validated.
Okay. Yeah, the whole probiotics narrative is a little complicated. It seems to me that if I'm going to get a probiotic, I would rather get a probiotic rich food as opposed to a powder, which is like, sauerkraut, kimchi, kefir, if you tolerate dairy or whatever. I know you have to go, so I'm going to wrap this up. I just want to do this quick 5 questions in 1 minute, short answer off the top of your head, just a fun little way to end this. Are you ready?
Yeah.
All right. How many times should a human poop to be considered normal?
Once a day to once every 3 days.
That's normal. Great. Do you have a favorite natural way to relieve constipation?
2 kiwis a day.
Do you have a favorite gut supplement or herb that you think could benefit most of the population? Very general, I know.
Does magnesium count?
Yeah.
Magnesium, peppermint oil if you have spasms and loose stools, but I like magnesium.
So magnesium could benefit everybody, whether it's citrate, glycinate, or any sorts of magnesium.
It all depends on like how much. Like if you're dealing with constipation, you want more oxide, but glycinate is great for all purposes.
What's one food you eat daily for gut health?
I don't have the best diet these days. I'm really stressed. I got some young kids. I ate a lot of chicken. My kids' leftover chicken fingers a lot. I think I would eat. If I had total control over my diet these days, I mean, which I do. I think yogurt's a really good one.
Coconut or dairy?
I think it all depends on are you have a lactose intolerance? Well, actually, there should be very minimal lactose in yogurt, but yeah, fermented yogurt would be the way to go.
And last question, and I hope the answer is yes. Are you pro coffee?
Yeah.
For the gut?
I mean, to an almost unhealthy degree, yeah.
Yeah? Okay, just like me.
But everybody's different. A lot of people with mast cell can't tolerate coffee. So it's individualized, but I'm big on coffee. I think there's a lot of good health benefits. But there's also, it drives me into like a panic attack sometimes. So
Yeah.
there's a balance there.
Awesome. Well, Dr. Zach, thank you so much for coming in. This was awesome. So much good information. I will put in the description a link to your website as well as your social. So if people want to find you, I know you're pretty booked out ahead of time, so people need to be aware that they might need to wait a little bit. But thanks for all the information. And now that we talked about SIBO, I feel like I need to get you back in a few months and do a full SIBO thing. So yeah, thank you. And yeah, and thanks so much. This was awesome.
I appreciate what you're doing, Julie, and thanks for having me on. And hopefully this didn't make things more cloudy, but it is murky. It is complex. Like there are not clear-cut answers. There's a lot of gray space. And I think it showed through with my uncertainty with some of these answers because, again, there's a lot that we don't know. But do things that we know are good for you. Whole foods, getting outside, being around loved ones, not drinking alcohol, sleeping well. Like you don't have to overthink it, but there's a lot of complexity, and it's okay that it's complex, and it's But yeah, I appreciate you putting yourself out there and helping people navigate this kind of world of ambiguity and feeling poorly and trying to get their health on track. So
I love that you don't speak in absolutes. It makes me trust you more as a doctor, and that you're able to say, I don't know, but we're going to try this, and this has worked. And if it doesn't work, we're going to try that, as opposed to just being, this is the way, and that's it.